medical doctor would be better placed to say that. So.
Yeah, it's difficult because the art of the doctor, we don't want to take that away. Unfortunately, I do think an unintended consequence of AI will be doctors being de-skilled in some capacity. And it's a dilemma for training. How do we make sure that doctors are enabled by the technologies and still know how a clinical acumen? The role always changes being a doctor, right? It has done over the last 100 years, quite rapidly so. And it's going to happen even more rapidly so across the next decade or two. So it's about how can training adapt to keep up with this pace of AI technology, for example. I think it's really difficult to sort of, so you're talking about like, that actual application and your assessment. It's really difficult for an AI model to really understand the little cues, everything that you do know, you've trained as a doctor, that there's interaction with patients, how they look at you, how they tell their story. Even sometimes if the patients are telling the truth. And sometimes you have a clinical acumen to say, I don't think I'm getting all of the story, or actually I don't think they're telling me the truth. AI will just tell it, word for word, unless you start bringing in, audio, visual, and I'm sure it'll get more complex and have much more multimodal data in the future in these models, but at the moment we're not there. It's just a large language model. It's what you write in it. It actually pulls out the data. So I think over time, the AI might get to that point. At the moment, we need to just know how to use this and put the right input so we get the output. Again, with LMMs, it's very difficult to know with this big black box how it comes to that decision making. And you were talking about clinical AI now, and we're talking about actually there's lots of great use cases with non-clinical AI that we're seeing. That's where I think doctors and clinical staff are building trust in these systems. But it hasn't quite, especially LLMs, not quite really taken off in the clinical, especially the regulatory landscape at the moment, which is we could probably sit here talking about it for the next 60 minutes, which is not interesting, but is very important. It's still a lot of work to do, I think, before we start seeing these co-pilots in hospitals as a regular thing. We're definitely getting there. I know somebody who's gone to the Middle East is working very closely with their LLM, and they're all eyes and ears, and people are very interested if this can make the doctor more efficient. That's never ethical, but I know we can talk about it. If you're going to make me see more patients, is that going to be good for the clinician? Or is that just good for the hospital? That's there's lots of AI tools that do that, and big ethical dilemma. Am I just going to be more burnt out as a clinician? Is that going to affect retention rates as doctors? Is it going to make me more miserable that I'm not using my clinical acumen judgment anymore, that I'm just putting everything in an AI machine? It's lots of questions that we don't have the answers to. Again, unintended consequences, but what's for certain is artificial intelligence will enter almost all aspects of healthcare, non-clinical and clinical.